Patients and clients are telling us that changes are needed to make the healthcare services they depend on more accessible and more easily available. Healthcare providers are telling us of their frustration at the gaps in the system that they encounter as they provide patient and client care. The recently released Drummond Report on Ontario's government services stresses that things are going to have to be done differently in the public sector if we're going to get real value out of every public dollar. And Minister of Health and Long-Term Care Deb Matthews has announced an action plan for health care that will be shifting spending away from things that don't improve patient outcomes and focusing directly on things that do. There is no question that change is coming in healthcare. In the Northwest region, we have a clear vision for healthcare and a plan for making the changes necessary to make that vision a reality. Picture this: a fully integrated healthcare system that puts patients and clients at the center of the system, closing the gaps that exist between services and providers so that patients can receive the care they need when they need it, as close to home as possible. Citizens will live longer, healthier lives, and our healthcare system will be there for generations to come. This is the vision we have for the healthcare system in Northwestern Ontario, and together we can make it happen. The Northwest Local Health Integration Network, or LHIN, is one of 14 LHINs created to plan, fund, and integrate healthcare services at the local level across this province. This ensures that healthcare planning reflects local priorities and that there's accountability for every decision made. Our LHIN funds hospitals, community health centers, community support service agencies, mental health and addictions services, long-term care homes, and the Community Care Access Centre. In January 2012, the Minister of Health and Long-Term Care announced that LHINs will also be responsible for planning primary care services. The Northwest LHIN covers a vast area of 458,000 square kilometers, extending west of White River to the Manitoba border. We encompass almost half of Ontario's landmass, but with only just over 222,000 people, we are home to only about 2% of the population. 3.5% of our residents are Francophone, and 22% are Aboriginal, with some of our First Nation communities in areas so remote that they're only accessible by vehicle in the winter via ice roads. Other communities are only accessible by air year-round. The Northwest LHIN is responsible for 13 hospitals, 2 community health centers, 63 community support service providers, 36 mental health and addiction agencies, 14 long-term care homes, and the Northwest Community Care Access Centre, and will become responsible for planning primary care services. Together with our partners, we've already made great strides in improving access to quality care and identifying and responding to local healthcare needs. We know, however, that there's much work to be done. If we're going to create a truly responsive, patient-centered, community-based healthcare system that will support the hard-working citizens of Northwestern Ontario now and for generations to come, there are changes that must be made. Our universal healthcare system is here for us today, but we need it to be there for our children and grandchildren tomorrow. And that means understanding the growing demands on that system and the changes that need to take place in order to meet those demands. The Northwest LHIN Health Services Blueprint is a 10-year plan to reshape, strengthen, and sustain our healthcare system so we can be sure that our children and their children will benefit from the same world-class healthcare that we do. We knew that the